right how that always works? If you just stand here for long enough, everybody looks at you and goes, is he going to start singing? No. No, we've had enough jokes about Barry White, no. Welcome to your centre. This isn't about me or about Alan or about Scott, who's going to come in a minute. This is about you and your involvement, relationship with the future of healthcare now. This is what this is about. It's about you. So for those of you that don't know me, and I can recognise a few people, I'm Victor Adebowale. I'm very proud to be co-founder of Visionable with Alan, who'll be speaking in a minute. I always say this just because it just makes me, it just relaxes me. For those people, that I think I'm amongst friends, actually. Yes, so you can all refer to me as the Lord Victor Adebowale CBE. I say it every time, it just makes me laugh, I don't know why. Victor will do nicely, Victor will do nicely. So I just want to say a couple of things. First thing I want to say, this is a really important day. I mean, in your life, it's very rare that you get a vision that turns into something in 4 dimensions that you can see and touch and hear. And this is one of those days. So I'm really proud to be here. And I just want to start by thanking everyone involved. Visionable is a company which really exists to do one thing, really: provide healthcare to everyone, everywhere. We are very clear that there are 3 challenges in healthcare at the moment, and we think we can do something to solve them. The first is equity. We know that. Some of you heard me say this before, but I just keep saying it because it's just so true. The fact that a woman in a poor part of Kent has an active life expectancy of 55 and in a rich part of Kent has an active life expectancy of 70 is not only morally wrong, it's economically stupid, right? And we can do something to solve that. The second thing is access. You can have equity, but if you don't get access, and we know there's a worldwide shortage of clinicians, we know there's a worldwide shortages of expertise, we need to create services that are meaningful to patients and their communities. We need to solve the workforce problem. Otherwise we don't get access. And the third challenge is digital. And the reason why it's in that order is that if digital can't help you with the first 2 challenges, why are you using it? Right? So welcome to the future of healthcare. That's Visionable. But I'm really proud that Visionable is in partnership with Verizon. And you might ask yourself, why, right? Why? Very simple. There's 3 things that are important to us. The first is our values. We're a values-driven business, right? So when we form partnerships, it's because we have a shared sense of value, of values. We have a shared vision for what healthcare can do. That's the first reason. We're a values-driven business. The second reason is, actually, there's loads of things that we can't do. We have a fantastic platform, a great vision, and we want to deliver. And we have a fantastic CEO. I don't want to embarrass you, but he's just dead cool. Yeah, he's coming on in a minute. But there's things we can't do. And what Verizon can do is this worldwide understanding of what healthcare could be doing, the potential of it, the connectivity, the ability to use digital and computing to create a great platform for solving one of the significant challenges for delivering healthcare, which is connectivity. So that's why we partnered with Verizon. It's why we're here. But please bear in mind, this is the start of something. We want you, if every person here tells 10 other people about the possibility of coming to a place where you can solve problems about the future of healthcare in the here and now, in the interests of patients, then you know what, we just might change the needle, right? So I always say this, the futures can be complicated and difficult, but why not start change here? Why not start change now? And with that, I will introduce you to Scott Lawrence, who's a really cool guy, really cool guy. And he's our partner with Verizon to say a few words. Scott, the floor's yours. Thank you very much.
I think you might be just a bit cooler than I, because I don't have Lord in my name. So good morning, good afternoon, everyone. My name is Scott Lawrence, and I have the privilege of leading our international business for Verizon Business Group. And at Verizon, we talk about creating the networks that move the world forward. And we do that in working with enterprises, working with governments, working with public sector, small and medium businesses working with the health and life science industry, really to help advance society as a whole. And so being here today and partnering with Visionable, as Victor said, it really is about the shared vision that we have together, shared goals on the impact that we can have on broader society and tackling some of the big, massive issues that are facing us, whether it's geopolitical, whether it's economic, whether it's social. There is a place for technology to really change the outcomes of people's lives, right? And so here at this amazing center, which we're opening today, it's an incredible opportunity to bring physicians, clinicians, patients, technologists together to collaborate, to innovate, to co-create new ways of changing people's lives and doing it in a way that is patient-centric, right? And I think that is the model that we need to shift. We talk about it on the enterprise side when we sell to enterprise clients. We talk about how to create a unique end user experience, right? That same model can be flipped around patient experience, how to deliver different pathways of care. Because quite honestly, we need to think differently to address the issues that we see and the divide that we see with equity and access. And technology can play a role, and digital can play a role in bringing that divide or eliminating that divide, right? But we need to think differently. But it's not just about the technology. We talked earlier today with a few people that it's great that we have this technology, but how do we also change the behaviors of the clinicians, of the patients, the expectations? How do we set a higher standard for care and really think about, not only how we treat patients during care and post-care, but how do we work with them prior to them ever even needing care, right? And how do we go into the communities that we're so fortunate to be able to serve every day? How do we do that and make it real for people that matter, right? So today is going to be an amazing opportunity to see the technology come to life. Last week in London at our 5G lab, we were able to host Visionable with us, sat on a panel for International Media Day that we had about 30 analysts and reporters in. And then we brought customers into our lab as well. And we did that because talking about new technologies like 5G and the power that private 5G can have on really delivering that change, you can't just talk about it. You can't see it on a slideshow. You need to actually see it come alive, right? And so having innovation centers like this enables people to touch it, feel it, see it, experience, what technology can truly do to unlock the potential that we all know is there. It's just now we have to take advantage of it and we have to accelerate it forward. And that's the key, is how can we work with Visionable and our partners, Juniper, Capgemini, and others, to come together to really deliver that accelerated outcomes that we all seek. No one company can do this alone, right? And I think part of what we're excited about is creating a foundation that bridges an ecosystem of all of these different global technology partners that will play a role in what we do today. And we believe Verizon has a critical role to play in connecting all of those different technology platforms and partners and providers together and putting it into the hands of the clinicians and patients where that change can actually take place. So super excited to be here. Thank you so much for the invitation, Alan and Victor. You guys have been tremendous partners through all of this. We're looking forward to tremendous growth as you go into the market and put an impact not only here in the UK, but really globally. And I know the ambitions that you have and see, and I share those same ambitions because there's so much opportunity for us in the room. But we need to challenge the companies we work for, especially in the technology space, to move faster, because we're not moving fast enough, right? So how do we do that and do it in a way that's going to positively impact society?
Thank you.
All right, Alan, let me hand it over to you. Thank you.
Hello, everybody. My name's Alan Lowe. I'm the chief exec and the other co-founder of Visionable. And it's quite ironic standing here as a moment in our journey that me and Victor somehow run a tech company. It doesn't sound right. But so the one thing for us is that Visionable's a people business. And the one thing that unites all of us today in this room, your background, your commercial, we're all patients. And we all want to have better healthcare for our families and for ourselves. So we created a healthcare company that said, you know what, we know the problems. Victor's outlined the problems of healthcare, and everyone in the room knows what's happening around the world. Technology is going to play a part in that and the future solution. So how we approach it at Visionable is we don't look at it as technology. We look at it as service improvement of the system with technology. And as Scott said, in fact, no one company is built that way. So what we do want to do at Visionable is orchestrate our expertise with the companies that have the right technologies to make a difference, the right values. And really, it's about, if you want to come together, it's around alignment. And the one thing we want to be aligned on is patient outcomes. And that transformation requires trust and understanding of healthcare. Because the one thing that really frustrates me is when people say, oh, the NHS need to do this, the NHS need to do that. People work in the NHS, very hard-working people, and it's tough. I spent 20 years of my life in the NHS, running frontline services and so on. The technology needs to help. It can't hinder. And we've had a lot of examples over the last few years with technology hindering. So what we want to do is, we've talked about the why. I want to talk a little bit about the how. And Visionable, I'm proud to say, we've pioneered a lot of the first ever digital stuff. We did the first ever cancer network, the first ever stroke network, first connected ambulance, first remote surgery. Now it's about doing it bigger and making it business as usual, as opposed to it can be done. So if you just turn to the slide up here, just very quickly, this is essentially what we've built at Visionable is, we've built an ecosystem where you can connect any location, whether it be a hospital, patient home, clinics, high streets, prisons, care homes. It doesn't matter about the location. Location's agnostic. We connect the healthcare professionals. We know there's a workforce shortage, and we want equitable healthcare. Why should you get better services for stroke patients in east of England than you do in west of England or in rural Texas? This is about connecting any physician, any specialist to any location. We also need great information. You know, we need the medical records, we need the diagnostics, we need the technology, because all this won't work unless you have reliability. And the one thing about healthcare, it can't work half the time. You know, it has to work every time. And that's why I'm really proud of our relationship with Verizon. And then what we're talking about is new models of care, not just going, we used to do it that way, now we do it with a video appointment. That's not transformation, and that doesn't help. So what we're looking at doing is complete new models of care. So if you just very quickly on the next slide, we're going to show you a couple of examples of what we're doing at the moment, and you're going to see that later on today. So look at it, we've got a connected ambulance solution, which we all know there's a big pressure on the ambulance systems at the moment. So we have a collaboration hub that you're going to see where we can connect the paramedic out in the field to any specialist anywhere. And that allows them to make a decision. Do we take the patient to hospital, or can we save beds and treat them in more appropriate location? Can we have a member of the public make the call and have eyes on the situation? So we don't need to send an ambulance. I'm giving you a high level of this, but this has been well received nationally and across all the ambulance services. Very simple to do, has to be reliable, but it's a new model of care. And then finally, the last slide, what we then do in the work we've done, look at a care pathway. This is stroke. How can these blue dots of digital technologies improve the outcomes, faster treatment, better treatment, and so on? I'm very proud of our relationship with Brainomics, who are in the room today. Again, AI to speed up the diagnosis, get them seen in the ambulance, get the diagnosis, get them to the right care. And obviously what we're going to hear from SameU later on about the rehabilitation. But let's make the service better. Let's be accountable for what our technology is doing in a process. And I think our role here is to hold each other in this partnership to account for those outcomes. So I'll finish there. Thank you for coming today. Really appreciate your time. And just to echo what Victor said, this is your centre. Like, this is a team of NHS and technologists and change makers to make a difference. So thank you very much. I'm going to hand over to Fred.
So I'm going to be very short because obviously I was briefed by everybody else who said 3 to 4 minutes, don't talk any longer, and that's gone really well, and only have one slide, and that hasn't gone very well either. So I am only going to show one slide. So I've known Victor and Alan for quite some time, and I'm very much a royalist. I like my Queen and country. I'm ex-forces. And I love the NHS, and I know you all find this amazing. I've got 10 grandchildren, and I know I look super young, right? But I got 10 grandchildren, and I want my grandchildren to have access to the NHS. I want them to have that same care that I got given, because I've been to countries, I've traveled the world and seen countries that don't have that, and I've seen what that actually brings. And if we don't take action soon, and we don't actually address the problems that are there, it won't be there. It won't be there for my youngest granddaughter. And we've got to make sure, and we've got a duty of care to make sure it does, right? And from my view, technology has let down healthcare over the years. We've deployed healthcare very sporadically, and to some degree, we've thrown it at healthcare and said, there's some healthcare, there's some technology, it's fantastic, off you go. And they don't know what to do with it. So we've built a connected healthcare platform, effectively, that takes technology from the partners here that we've worked with and an ecosystem to deliver that end-to-end clinical pathway that Alan just showed, if you take stroke care. And what we've allowed it to do is you can take one patient at home, one care home, and 2 nurses in front of a screen, and that's my virtual ward, and I can run that. Or I can take 500 care homes, 1,000 patients at home, and a whole command and control center like you see at the back there, and I can scale to that. And I can do that in a modular way, which means I can do low cost of entry, I can create alongside my existing infrastructure, and I can move slowly. Because nobody in any healthcare system can stop what they're doing while they transform. And that's what technology is expected healthcare to do. Stop what you're doing, here's a great thing to build, go and build that, transform and move to it, and life will be great. And it dies on the first day because nobody can actually stop what they're doing to get to that next piece. So what this model gives you is a full end-to-end service, from delivery to deployment to maintenance and operation, right through to adoption and training, to ensure that it becomes a sustainable change within that healthcare organisation. And that's what we wanted this to be, is sustainable change, not just some technology that looks really good, but doesn't actually fundamentally change the way that you work. So that's what we tried to get to. That diagram there is represented here, which is the other thing we wanted to do. We didn't want to go out and speak to people with some slideware. We wanted to be able to show that and say, come here, and we'll recreate that here, bring your clinical pathway, and we'll try to digitalize that for you. So that's what we tried to do. Hopefully you enjoy it today, and thanks a lot. All right, cheers.